This is Black Mental Health Matters. I'm Dr. Kerry-Ann Williams. I'm a psychiatrist practicing in Massachusetts. And this is a podcast that's about everything related to mental wellness in the Black community and beyond. Today, I wanted to answer a question that I get from time to time. It is the question, Dr. Williams, do you believe that multiple personality disorder is a real thing? Well, today I'm going to answer that question for you. Now, to start with, in the lay public, people often confuse the terms schizophrenia and multiple personality disorder. So I'm just going to clarify that first. Schizophrenia is a psychotic disorder where people may experience severe paranoia, delusions, and hallucinations. Multiple personality disorder is not psychosis. It is a fragmentation in your sense of self. And even that description is a bit of an oversimplification because this is just the introduction. So, do I believe that multiple personality disorder is a real thing? Guys, I've seen this. I've had patients that meet criteria for this. But like many things that I've taught you all on this podcast, things are not always what you might think that they are. So when TV or movies try to depict multiple personality disorder, they play it up to make things more entertaining, to draw the viewer in. But today I want to clarify and dispel myths. So I hope that you find this helpful. Now, to start with, multiple personality disorder has been renamed. It is now called Dissociative Identity Disorder, or DID, which is a name that's a bit more descriptive and more accurate in terms of what's actually happening. So rather than saying that a person has multiple personalities, we say that they have a dissociative identity. And I'm going to explain what this is in today's episode. Now, when someone has multiple personalities, they're experiencing something called dissociation, but they're experiencing it in its most severe form. When someone experiences dissociation, they're having a disconnected psychological experience. So I'm going to give you some examples of what a disconnected psychological experience can be like. Now, this is not dissociative identity. This is just dissociation itself. So if you've ever experienced something shocking, like a car accident or a tragedy, in the moment, you may have the distinct feeling that this is unreal, that this could not possibly be happening. This is a dream, it's a movie. It doesn't feel like real life. You may even feel like you're watching things happen, but that you're not a part of it. And this is called derealization. It's a type of dissociation. And it's one way that we can feel disconnected psychologically from something that we are physically a part of. Another example, someone who is trapped in an abusive situation, maybe domestic violence or just any other kind of abuse, really, they may start to have an experience where even though they're physically present in the situation, their kind of personhood, if you will, is detached from the situation. So they feel like an outside observer. So while the person is yelling at them, hitting them, they may start feeling numb inside. They've detached. And that's called depersonalization. Now, this is an important experience to pay attention to. This ability of the psyche to detach from the physical experience is a type of defense. It's a psychological defense. And it can be difficult to describe for the purpose of this discussion, but I'm going to compare it to a circuit breaker. Now, I'm not an electrician, so please forgive me for any errors that I may make with the following two analogies. The electricity in your house generally runs on circuits. If you plug too many things into the outlets, the circuit will trip, and that is protective. The other thing I think of, and most people in North America don't have to really think about this, but it's a concept called load shedding. In some countries, the demand for electricity starts to exceed the available supply. And in order to maintain the integrity of the electrical grid, they have to do something called load shedding to prevent catastrophic grid failures and extended outages. That usually means customers will have periodic power outages. Now, similar with dissociation, If you want to maintain the integrity of the electrical grid, you have to do some load shedding. You have to disconnect from the grid as a type of protection or defense. And that's how dissociation starts. It starts off short term, protective, even adaptive. Unfortunately, even after a person has survived trauma and they're no longer in the threatening situation, their minds may continue to experience periods of dissociation, especially when under stress. And this is when it becomes a disorder, is when it's no longer adaptive, but it's now becoming intrusive. Okay, now dissociation can become complex and can manifest in different ways. And I'm going to talk about a couple of them just to lay the groundwork for the idea of dissociative identities. So I want to talk to you first about something called dissociative amnesia. And when this happens, your disconnected psychological state causes you to forget who you are. Usually it's triggered by something stressful, but it's time limited and it tends to spontaneously resolve. So that's amnesia. The other is something called fugue, dissociative fugue. This is a combination of the amnesia plus travel. So this is where that dissociation, that psychological disconnectedness causes you to forget who you are, forget your past, but also to travel somewhere else. When people find you, you're not able to describe who you are or what you're doing there. But this also tends to be time limited and can resolve. So now you know that dissociation can make you feel like things are unreal. It can make you feel disconnected from your own body. It can make you forget historical details about yourself and your past when it's severe. Now let's talk about how it can affect your sense of self, your identity, what some people might call your personality. Now, you may have worked this out, but I should say explicitly that dissociation is generally a response to trauma. But trauma is defined by the beholder, so to speak. Traumatic stress can have this effect on our psychological state. Dissociative identities are a more severe form of dissociation, and they tend to be linked to severe trauma in childhood more often than not. To meet criteria for dissociative identity disorder, the person must show distinct and separate identities. This is important because many people who experience trauma may end up having a lot of like dimensions to their identity, what we call dissociative parts, but they may not have a distinct other self that manifests. Now, often the person with dissociative identity will say that they have lost track of time, especially when they're first starting to discover that this is happening to them. But there's not losing track of time in terms of forgetting what time it is, but rather, finding themselves standing somewhere, but not remembering how they got there. And then they'll look at their watch and they think, oh my gosh, 2 hours have gone by and I don't know what I did for the last 2 hours. But maybe they're a friend or a traveling companion might be with them, and they'll say, "Oh, for the last 2 hours, I was talking with you about such and such. We were having a conversation for the last 2 hours." And dissociation can make you forget. And in this severe form, it can lead to different versions of yourself. Now, an outside observer can sometimes tell when that personality shift occurs. They may see that there are differences in how you speak and in your emotional expression. And some people may even regress to a younger age when they dissociate. So they have an alternate personality that, for example, is 7 years old. So, and remember that this is occurring very often in people who have severe childhood trauma. And then sometimes the identities also have different names. Now, in therapy, the person is often aware that they have different versions of themselves that they switch into. And they may have an awareness of the triggers that lead them to switch, but they struggle to control the switching. One personality may be a bit more aggressive. One personality may drink while the others don't drink. One personality may be dominant and may be that person's kind of baseline personality, if you will, a baseline self. As I mentioned, one personality may be a different age. Now, what do you do when this happens? As I said, on TV and in movies, they make things appear really dramatic and entertaining, but in real life, this is debilitating. Imagine trying to keep a job if your self state switches whenever you're under extreme stress. Also, one of the reasons that people with someone with this diagnosis might see me for an appointment is because they may have depression, sleep problems, mood swings. Sometimes they might see me for the aggression. I've had several patients who are fearful of their capacity to become angry. They're worried about the intensity of it. Because when they dissociate, when they psychologically kind of disconnect from a situation, they may express anger and feel a loss of control over it because that anger is coming out as a part of their body's trauma defense mode. Now, what I haven't mentioned yet is that when a person has experienced severe trauma, sometimes there's that part of them that also wants to hurt themselves. And this can play out in dissociative identities as well. And this fragmentation in their sense of self can lead to suicidality and self-injurious behavior, such as cutting themselves. Okay. So again, how do we treat this? What do we do about this? And I wish I could tell you the solution was simple, but it is a combination approach. And the first step is to have an accurate assessment. So make sure that you're seen by a psychiatrist, a psychologist, or other mental health provider who has experience in this area. This can be hard to find, but your search criteria should include folks who specialize in trauma. Now, many therapists will say that they work with people who have trauma because they do, but they may not have experience working with people who have severe dissociation. So in your screening phone call, you want to ask if the therapist or doctor has experience working with people who experience dissociation. Now, when you do find a therapist that you feel comfortable working with, they will work with you to try to reduce the fragmentation in your sense of self and promote integration, psychological integration. And from a medication standpoint, medications are often used to treat the specific symptoms, as I mentioned, most commonly depression, suicidality, mood swings, sleep, anxiety. There's an understanding that sometimes when a personality switch occurs, it can override what the medications are doing. So that happens sometimes. And that's because sometimes the personality switch occurs as part of the trauma response, which is your survival or your life or death response. And that can affect the effectiveness of medications. So medications can work to a certain point, but the goal is for the medication to help save your life, to reduce your risk, reduce hospitalizations, and facilitate the therapy work. So it's a very important part of the treatment. And the last thing I'll say about what we do is that besides the high quality individual therapy and medications, there are other trauma interventions out there I've mentioned on my podcast before. Remember, I said that trauma and dissociation can cause us to feel disconnected from our bodies. So interventions that can help you to feel more connected to your body, like yoga, for example, that helps to promote connection and attunement. So I would say definitely consider some of these other types of interventions as well that help to kind of intervene at the level of the body, the connection and attunement to the body. So hope you guys are learning something here. Hopefully the next time you hear someone talk about multiple personality disorder at a party, you can say, well, do you know that multiple personality disorder has been renamed to dissociative identity disorder? And it's most common in people who've experienced severe childhood trauma. And well, at that point, the person would probably start losing interest in the conversation with you. But at least now you know what DID is. Now, before I end, I just want to say this topic today was not specific to Black mental health. However, the topic of trauma is very important in the Black community. And whereas DID is not the most relevant thing in the Black community on this day in history, dissociation itself is actually very common. And it's missed to our detriment. And can I tell you something? As someone who specializes in trauma, I can see the dissociative reactions happening in those videos with Black men interacting with the police. You can see the freezing up, the bolting. You can see all these trauma responses. I can see it, and it brings tears to my eyes, particularly when it results in a loss of life. So dissociation as a concept is very relevant in the Black community. But that's where I'm going to end for today. What did I not cover today? What questions might you still have about dissociative identity? Let me know. Link up with me on social media. Thanks for joining me today. You've been listening to Black Mental Health Matters. I'm Dr. Kerry-Ann Williams. Have a great week.